I am Vanita Rahman. I'm an internal medicine and lifestyle medicine physician, and I'm the clinic director at the Barnard Medical Center and the Physicians Committee for Responsible Medicine. And if you think about it, nutrition is playing such a key role in everything. We have clear evidence, and most people accept that it impacts our individual health. What we put into our bodies 4, 5, 6 times a day makes a big difference in our health. But maybe there are things about food that we don't think about. For example, research shows that agriculture generates greenhouse gases, right? But what we know is that animal farming or animal agriculture generates a lot more greenhouse gases than plants do. And we know that livestock production, raising livestock, feeding them, using them for food is contributing significantly to greenhouse gas emissions. And that is actually impacting our health in a couple of ways. So when we create these greenhouse gases, we are we're contributing to climate change. And that's one, but the other impact is we are also causing more air pollution. And so both of these impact us. So for the first one, with climate change, we see more natural disasters, more flooding, more droughts, more wildfires. I pulled in yesterday into the airport here and I thought, what is this haziness everywhere? There must be a wildfire going on somewhere. And that is poor air quality that impacts us. And so through climate change, there's direct impact to individuals where there's human disaster and catastrophe. But then as the air quality changes, that impacts all of us. And that leads to asthma flare-ups, cardiovascular disease, lung disease, premature death. And we know data shows that even from the COVID pandemic, air quality contributed to unnecessary death and suffering. So the type of food we eat doesn't just impact us directly as an individual through our environment, it's also impacting us. But then it's impacting our communities, right? So if it's the animal community, it's impacting them, obviously. It's not the most humane way to live. But then at even a population level, we're hearing at this conference about certain populations are more vulnerable. For example, I'm from South Asia. And Dr. Kim Williams just talked about how South Asians have a 40% higher risk of cardiovascular disease, premature death, than other populations. And a lot of that has to do with our body type, how we store fat. And what's contributing to that is our diet. And we have to change our diet. So it's really impacting all of us in different ways, some of us more disproportionately than others.